Have you hurt yourself? Have you been in a car accident? Did you sprain your ankle while playing soccer? This is Dr. Todd Lloyd. I'm coming to you from Rincon Chiropractic in San Francisco, and today I'm going to talk to you about soft tissue injuries. What kind of soft tissue? I'm talking about muscle tissue, tendon tissue, and ligament tissue. Now the muscles, you know what the muscles are. They're the contractile elements of the body. They keep your body upright. They keep you moving through space. And they look good on you. The tendons that are attached to the muscles. Tendons attach the muscle to the bone and help assist with movement. And actually tendons are important for all aspects of movement because the tendons have a certain amount of stretch to them. So every time you plant your heel on the ground, tendons absorb the energy to help propel you forward. They work with the muscles in storing energy for movement and propelling you forward, that elastic movement forward. Now ligaments connect bone to bone, and ligaments are there for stability, for proprioceptive awareness, where you are in space, and it lets you know where you are. And if a ligament becomes injured, you're in big danger of making a body part unstable. Now, the first thing I want to talk to you about is a muscle injury. Muscles can be injured in 3 different ways. You can cut a muscle, that's a laceration. You can have a blunt force against a muscle, that's a muscle contusion. It produces a big bruise. Or you can have a stretch on the muscle, and that's a tensile strain, a stretch on the muscle that can tear the fibers within the muscle. Now, either way that you injure a muscle has to go through the healing process. Now, the good news about muscles is that they have a really good blood supply. You look at a muscle fiber under the microscope, you see a lot of blood vessels going to the muscle that helps bring fresh oxygenated blood and carries away blood that has used all of its energy and oxygen to make the muscle contract. Good blood supply means faster healing for a muscle. Now I'm going to talk about a muscle strain, a tensile stretch on the muscle first, which is the most common sort of muscle injury that we see here in this clinic. If you look at a muscle, you can dissect the muscle out. You can see these fibers that run parallel to each other and in series. These fibers run up and down the muscle in line with the way the muscle is going, and these fibers are contractile elements. If you overstretch a muscle, then these fibers can pull apart, and this creates destroyed tissue. Immediately after an injury, along with all the pain and the swelling that happens, there is active bleeding in the area. And with active bleeding, a blood clot forms, and this blood clot sets the stage for the healing process for the muscle in the next few weeks. Now, when a blood clot forms, it forms between one healthy part of the muscle and connects that healthy part of the torn muscle to the other part of the torn muscle that has become disconnected or partially disconnected, a ruptured muscle fiber. This blood clot will form a scaffolding that bridges those 2 ends together. This could be a micro tear, it could be a huge macro tear, but the blood clot will form this scaffolding. Fibrin within the muscle, the platelets, will help with the scaffolding. It's like putting down fibers that will tell your muscle cells which way to regrow. So a myocyte is a muscle cell. The myocytes are undifferentiated cells at this point, and they go onto the scaffolding, and they plant themselves in that scaffolding, and from there they're going to start to branch out. The crazy thing about muscles is that this happens so fast. This could be in as little as 2 days, where you can start to contract these fibers again. And up to 10 days until that bridged muscle fiber area becomes a contractile element again. So in as little as 10 days, you can have muscle activity back. But Now here's the first lesson here. This is your quick win. If you tore a muscle, you need to wait that 10 days before you start to stretch it out again. Stretching a freshly injured muscle is counterintuitive because there's a scar tissue activity happening in these torn muscle fibers that has to be respected and be left alone. You can't force a stretch in there. It's going to be counterintuitive. It's going to slow down the healing process. Should you be moving though? Yes. Active movement, early active movement is very important for a muscle strain. Keep moving. Passive movement at first, and then isometric contractions where you're contracting against nothing, leading to a more active contraction type of exercise, particularly eccentric contractions. But more on that later. If you tear a muscle, should you use ice or should you use heat? This is a hydrocollator pack. It's made out of clay with fabric wrapped around it. It sits in a hot water bath, and this is what we use in the clinic for heating up someone's back. This is a gel pack. You can ice it, you can store it in the freezer, or you can microwave it. Well, after you injure a body part, you have to keep in mind what processes are going on. If it's a closed injury, usually the inflammatory process that happens is overkill. So in the first couple of days, ice is appropriate for your injury. After that first couple of days of a muscle injury occurs, then it is appropriate to lay down some heat. Put some heat on the muscle. What happens with ice? Ice will slow down the metabolic process. It will reduce inflammation, it will reduce swelling, but it will also slow down the metabolic process. It's appropriate because inflammation is overkill in the first stages of healing. But it's going to slow down nerve flow, it's going to slow down your blood vessel access to the injured tissue. So after the first couple of days, you want to bring more blood to the area, and that's when it's appropriate to have heat. Put heat on an injured area, and that will bring up the metabolic activity. It's going to accelerate the nerve flow, and it will restore blood flow to the area better. So heat after the first 2 days of an injury. So after a muscle injury, you want to return to having continual active motion. You want to take an injured body part and start moving it through its range of motion as soon as you can without too much pain. And so if it's in the context of your neck, you want to be moving your neck through its range of motion by doing some side bending, maybe some chin tucks, just to get things moving. Now, it shouldn't be painful. If it's painful, you still have some more passive healing to do. But if you can tolerate it, then it's appropriate to be involved with your active healing. Active healing is muscle contraction. And after it becomes comfortable to go through passive range of motion, then you want to introduce isometric contractions. And that's why I'm holding a kickball. This is an 8.5-inch kickball, playground ball. We get this from Amazon. You can get it anywhere. You can get it from Target or Big Five Sporting Goods, whatever. You want to get a nice rubbery one because it's going to have that nice give. And because it's round, it's going to control and coordinate your range of motion. This is for the neck. So, after a muscle injury, you want to start doing isometric contractions. Isometric contraction means a contraction where nothing moves in your body. So with a kickball, what you're going to do is you're going to put it against the wall, and you're going to put your head against the ball, and the wall is my hand. You're going to contract against the ball without your neck moving. And you're going to want to go through different ranges of motion too. Front, side, other side, back, front 45 degrees at an angle, isometric, nothing's moving. So you're just going to push into it. You're going to feel your muscles contract in your neck. You're going to do about 10 seconds on each direction. 10 seconds, 10 seconds, 10 seconds, 10 seconds. And you might do this 5 to 10 times. And the reason why, you're not pushing hard enough to really create big strength gains, but you are preventing atrophy of what's called type 1 muscle fibers. Type 1 muscle fibers are fibers for endurance. And all of your spine muscles are heavy with endurance fibers because they're postural muscles. They're shunt stabilizers. Every time you move a limb, your neck muscles have to contract and coordinate to keep your spine stable. So with a kickball, isometric contraction, you should do that for endurance, which only takes about 10 seconds. You hold it for 10 seconds. That way you can prevent the loss of type 1 muscle fibers in your neck. This applies to any body part too, even the biceps, which is going to be more of a type 2 strength or sprint muscle fiber. You're going to want to do isometric contraction for an injured biceps to prevent that kind of atrophy too. After you get good at the isometric contraction, and this is about the 10th day of a muscle injury, maybe at day 12, you start getting better at it, and you want to start doing something more active, where you're going to take your neck from its neutral position, and you're going to tilt it to one side to challenge it in a different range of motion. Again, doing that 10-second contraction 5 to 10 times. When you get good at that, then you're going to want to be a little bit more dynamic, and you're going to want to move your neck through its range of motion. And the important part here with muscle rehab is that you're going to start out in this contracted state, and you're going to contract against it and slowly move out of it. And this is what's known as an eccentric contraction. This is a hip circle band that I use for hip rehab, but I like this because if you look at it closely, you can see fibers in there that make it designed to go in this direction. An eccentric contraction will take muscle contraction, and you're going to slowly let out that muscle, challenging the fibers that cross-link to each other to create muscle strength. So isometric contraction, nothing moves. Isotonic is when you move your muscle against resistance. And eccentric contraction is when you start out in a contracted state and slowly let that muscle out. In the context of your neck, you start out here and you slowly let it out to where these muscles are lengthened again. So that's muscle activity and muscle healing. Now, tendons are what are attached to muscles. Muscles go into tendon, and then the tendon goes to bone. And as the tendon attaches to the bone, it starts out really tightly packed, and it goes back out and kind of flares out into these fibers that go to your bone. Tendons have a really bad blood supply. Now, they're living tissue, and they're very dynamic. They'll respond to whatever you throw at them appropriately, biologically appropriately. But bad blood supply means they take a longer time to heal. And a lot of people get caught up into having a tendinopathy, where they have incomplete healing of a tendon, where particularly in the case of tennis elbow, at the attachment of these wrist flexors right here at the elbow, you can feel it yourself as you contract your wrist into extension. That can become very tender, painful, and it can take a long time to heal. And if you have an injury to a tendon, the fibers that should be tightly packed in there become disorganized. Inflammation goes in there, fluid builds up, and it presses those fibers apart. And the goal should be to realign those fibers, go from disorganized to organized and tightly packed again. The same rehab principles apply to a tendon. You take a muscle, you contract it. As you contract the muscle under tension, then it's going to pull on the tendon too and reorganize those fibers. Okay, so a tendon goes from muscle to bone. What does a ligament do? A ligament goes from bone to bone. This is usually my muscle demonstration device because it's so elastic. Tendons are a little bit elastic too. If you look at a tendon or a ligament, particularly a tendon under a microscope, you'll see the fibers in there are crimped in a certain way. Tendons are designed to stretch under load a certain amount before they go into more of a rigid structural support and allows the muscles to move it. But the crimped elastic fibers in a tendon will allow you to store energy and then release it when appropriate. And this is more appropriately done during the gait cycle. Every time you do a heel strike, your foot and ankle, your knees, your hips absorb the shock of the heel strike to propel you forward when you go toe off again. All right, so back to tendon. Tendons have a really bad blood supply. Tendons are tightly packed type 1 collagen fibers with sometimes some elastin in it. There's a big tendon in the back of your neck called the ligamentum flavum that has a lot of elastic fibers, but most of the tendons, like in your shoulder, very tightly packed, secure, stable structure. But if you injure a tendon, then it's going to take a long time to heal because of the bad blood supply. My textbook I got this information from says that when you injure a tendon, your body is going to start growing more blood vessels. The fibers in the tendon become more and more disorganized over time. And this whole process of disorganized fibers can take 40 weeks to occur. 40 weeks, 10 months. 10 months of the healing process before your tendon turns the corner and starts to reorganize the fibers to line up for the optimal healing experience. So we're talking about muscles that can take 10 days before you can start using again, to ligaments that can take 10 months to go through this healing process. So if you've got a disruptive tendon injury that can leave you with some hypermobility and loss of structure, you're in for a long healing process. Now, the good news is just like with muscles, you can influence the healing of the tendon through the rehab process. Use your muscles to do the muscle rehab, and any tendons that are associated with the structure that the muscle is associated with, they'll get rehabbed at the same time. So if you rupture a tendon which is internal to your shoulder, you want to continue doing shoulder rehab exercises to get the muscles in your shoulders to become contracted and stabilized. This is going to help prevent instability from a torn tendon. Same thing for your neck. Neck has a ton of tendons in it. It's also got a ton of muscles, and you can contract and coordinate your muscles in your neck to help rehab the tendons in there too. But just know that it's going to take like a year to heal those tendons, whereas with the muscle, they can become strong again after like 14 days. So there's a big difference there. You have to respect your tendons. Tendons are the ones that make you vulnerable to re-injury because tendons are often associated with incomplete healing. Tendons are important for proprioceptive feedback, neurological feedback, balance and coordination, the sensation of where your body is in space. So tendons take a long time to heal. You, as the owner of your own body, have the responsibility to rehab those tendons for the period of up to a year. So I'm Dr. Todd Lloyd. Hope this helps. If you have an injury to your spine, whether it's muscle, ligament, or tendon, then you need to take the appropriate steps to rehab that whole process.